Uterus in early pregnancy is a complete term for the female reproductive system of a woman in the early stages of pregnancy. Since the uterus is the only part of the woman's reproductive system that is directly involved in the process of pregnancy, the uterus is said to be the center of the woman's body. Additionally, the uterus is one of the strongest muscles in the human body. It is capable of expanding to over 200 times its normal size during pregnancy and childbirth, making it one of the few organs that can exceed its normal size. Where is your uterus in early pregnancy? The uterus is the muscular organ where a fetus develops. It is the place where a fertilized egg becomes an embryo and later a fetus. The uterus is part of a woman's reproductive system. In early pregnancy, the uterus is where the embryo implants. If this does not happen, you may have an ectopic pregnancy. A normal uterus is pear-shaped. It is about 3 inches, 8 centimeters, long. How to feel your uterus in early pregnancy? There are a few ways to feel your uterus in early pregnancy. One of the best ways is by placing your hands on your abdomen. You will feel your uterus rise up as it gets bigger. You should also be able to feel your uterus throughout the day if you press down on your abdomen. If you have a partner, have them place their hands on your belly to see if they can feel the baby move. Feeling your uterus in early pregnancy is a great way to know how far along your pregnancy is. This can also help you figure out what stage of pregnancy you are in. Your uterus is the pear-shaped muscle that is the home to your baby. It is about the size of a small orange at the beginning of your pregnancy and can grow up to the size of a watermelon. It is located in the lower part of your abdomen. If you have had a baby before, you will likely feel your uterus much earlier in your pregnancy. A doctor may be able to feel your uterus around week 6 or 7. Pain in the uterus in early pregnancy. During early pregnancy, you may feel very mild pain in your uterus. This could come from many different factors like constipation or gas, the womb expanding, and stretching your ligaments to make room for your baby. Or, it might feel similar to menstrual period cramps because of implantation, which occurs in about a quarter of all pregnancies. If the cramps you feel in your uterus go away on their own, it probably isn't a cause for alarm. But if they get worse or are accompanied by heavy bleeding, you should seek medical attention at once. How to increase blood flow to the uterus in early pregnancy. Many women experience decreased bloodstream to their uterus when they are pregnant. One of the reasons why this happens is that the blood vessels become compressed because of the growing uterus. The placenta will also play a role in this because it is a growing organ too. In order to increase blood flow to the uterus, it is necessary to have a healthy diet. Is your uterus hard in early pregnancy? One of the most common early signs of pregnancy is a hardening of the uterus. This usually happens when the fertilized egg is implanted in the uterus wall. This hardening can be felt by women who are about 2 weeks pregnant or even before. The uterus will be harder to touch. Since there is a fertilized egg in the uterus, it will be very hard. You need to note that the hardening of the uterus is not a pain. It is just a change in the texture of the uterus. Can you palpate your uterus in early pregnancy? The uterus is not palpable until after the 5th or 6th week of pregnancy. The uterus will remain out of reach until the middle of the 2nd trimester when it begins to lower into the pelvis. By the end of the 2nd trimester, the uterus is easily palpable. Many women experience pelvic pain, cramping, or pain during the 1st trimester. This is, in part, because the uterus is growing so quickly. Palpation is a very important part of your checkup and can help your doctor determine whether or not your uterus is growing normally or if you have any birth defects. It may also be used to determine if you have a subchorionic hemorrhage, bleeding between the placenta and the uterus.